This morning we are going to an incredible temple. It's in the middle of nowhere, and somehow people who get paralyzed or injured, who cannot walk and who have problems of using their hands, they are brought there for healing. It's called the Healing Temple, Jetla Mata. And I've been coming here for so many years, and it's one of my favorite places for training doctors, because I show them how I treat disabled people, and it's quite amazing that so many people still come there. The belief is that they have prayers several times during the day when the offerings are made to the goddess, and during that period these paralyzed people, they get healed, and some do for whatever reason, but there are many who don't, but they stay there for a month, sometimes several months, and they hope for the best. So I'm going to show you what I can do for some of them, hopefully. So let's go there. So here we are in the healing temple of Jetla Mata. For hundreds of years, people have been coming here with strokes, polio, and other neurological disorders to get better. Somehow, some of them got better with the ritualistic prayers and dances and music every few hours throughout the day. So I came here once to train the doctors, and we worked on 2-3 stroke patients using my technique of rehab, and they were feeling better, and 2 of them stood right. And so I went there to see what was happening. The first case I saw was that of a lady who had a stroke at 8 o'clock in the morning, and I was there at the temple maybe around noon, and I started treating her. It took some time. People were surrounding her, and we couldn't film it properly. And I treated her neck, then I treated her legs, and improved the power in the legs by asking her to push my hand, and the power came back. So she was paralyzed on the right side, but after this treatment she felt better. So I decided to make her stand. It was tough, and all along I was showing the brother of this lady what had to be done, and the brother watched everything carefully. Then when she stood up, I locked her knee so that it wouldn't be wobbly, and made her stand straight. Because she had gained some power in the leg, she was able to do that, put weight on that foot, and she stood up. So when I was treating other patients, then I sort of came back to this lady, and she was gone. Apparently she walked home, with support. So there you are. She had the stroke at 8 o'clock in the morning, and by, let's say, 1 o'clock he was walking home. And somehow my cameraman recorded that moment when he was walking home. So, of course, the word went round. There were hundreds of patients lying on the floor, and it was a Sunday, so there were more people. Then there was this arti or prayers, and they all went there to pray. But I continued seeing other people. There was this lady with very bad sciatica, so much so that she couldn't move her leg at all, and as if the leg was paralyzed, the right side. And I saw her. She was in great pain, but she couldn't move her leg. So I felt that the hip joint was involved in this. So I treated the hip, gave her some more treatments of the hip region, a little bit on the back, and she was pain-free, and she could move her leg after that. And I showed the relatives where the treatment had to be done, and demonstrated that, gave her a couple of exercises she did, and she was better. I don't know whether they walked home or not, but I guess they would have. And then there were these children. I was surprised. 2 of the children that I saw had stroke. So I taught the mothers how to treat. First we did the neck connection treatment to get the blood into the brain, and then we had give them some more treatment with my technique, massages. And a few days later I got a message to say that both of them are now walking. They're limping, of course, but they are walking. So I'm very pleased about that. Then there was a child who had with problem of walking. She had cerebral palsy. So I showed the treatment to the mother. He was crying a bit, but and I told her to do that for at least 3 months, for 20 minutes a day. Then there was a case of Bell's palsy. The left side of the face was paralyzed, and so I showed the relatives how to treat the face and do the neck connection treatment, which is what I do. And for these cases, the relatives watch very carefully. I taught them. You see, I always like to teach the relatives, because I don't live here, and nor can I sort of give them any treatments on a regular basis. So they do the treatments, and some of them do follow up, and there have been good results, you know. So in the valley or in this area, when I go to the different villages, they recognize me, and people come to me because we've managed to do some good for them. And so that's how, by word of mouth, you know. And here there's a peculiar thing, that if the patient comes for treatment, there'll be 2 or 3 relatives with the patients, and they would be watching carefully. So at least if one doesn't do that, then somebody else in the family will do it. And this is the way I've been treating the tribal people, the needy people of this tribal belt of Rajasthan, and I enjoy doing that. Then there was this case of another lady who had problem with the left leg, didn't move at all, and she was limping, she had difficulty in even standing on her own. So she's the one in the red sari, and I found out that she had problem with the left hip joint. So I treated her, gave her some exercises, and she was able to walk. And hopefully the relatives will follow that up. So I sat with them, some of them, outside the temple, and spoke to them. And so some more people came in with problem of the arm and shoulder pain and all that. So this gentleman does a lot of physical work, and he has to carry things, lift things. So he's got problems. He's getting trigger finger, like he can close the fingers, but sometimes they, you know, these 2 fingers, they don't close properly. So the treatment that I have advised is massage here. This, ये इस जगह पे massage करें. So massage यहाँ से लेके up to here. She massage this area. और यहाँ करके जिस उंगली तक, you know, is to go all along the fingers like that, the thumb here, and of course the fingers, massaging like that, starting from here करके, and exercise ये करना, ऐसे मुड़ना, फिर वापस, ठीक है? Okay. This, and then this. So ये करके दिखाओ. ये, तो मसाज करना यार, ये दर्द हो रही है ना, पेनफुल. हाँ, यस. ये करके, ये सब करके ठीक है. इनको मालिश करते तो ये दर्द. हाँ, वो कमर में करना पड़ेगा, पानी कम पी रहे हो, इसलिए हड्डी के ऊपर हड्डी आ रहा है. हाँ, और चलना पैर को सीधे करके, ऐसे करके नहीं.
मैं सीधे ही चलता हूँ.
ठीक हो जाएगा.
Thank you, sir.
Okay. We had a wonderful time in the healing temple. I saw several people here, and most of them had strokes, but there was one who had back problem, and because of which one side didn't work. The leg, she couldn't move, she couldn't stand on it. We got her to stand up, sit down and stand up. And then the stroke patient, we treated one of them, so she's gone home now. So it's been a wonderful journey. I've been here so many times with my doctors, NHS doctors. I trained them here, showed them how to do physical rehab, traditional physical rehab, which involve massages and some treatments, sometimes some manipulations. And it's been wonderful being back here after so many years. It's been a lovely day, wonderful day. I enjoy going to this healing temple because there's so much for me to do. I couldn't see everybody because that would have taken a long time, but at least I could help some of them or taught their relatives to help them, and it gives me immense pleasure. We have come to see the harvesting of opium. It's a very interesting process.